pretty much every month with who's got the highest. But so we're expensive because of that kind of stuff. But that tax is what's embedded on top of every bill.
And I'm going to suggest that maybe Ernie and
No,
Tom are like Rochambeau for who gets to go next.
I'm going to go, then I'll let him beat me up. Then I don't get my say in.
I was going to make fun of Tim.
Yeah, oh, good.
He comes here for therapy. He says, I am a cost shifter, and I'm proud of it.
That's right.
We buy services from them, too.
One of the things about Kaiser, and this was actually, I was glad you asked this question because it was, what I've learned at Kaiser Permanente, which is, I've been there about 8 years now, it's always a treasure hunt. When I don't know the answer, I wander around with this ability to ask many people, like, what are we doing in this area? And I always find out little nuggets of information that I didn't really know, this being one of them. And historically, because of who we are, integrated care delivery, we're also a health plan and a care delivery model, we've been exempt from reporting any of the investments we make in the community. We don't have to report it like others do on their balance sheets for uncompensated care. So that's the first thing about sort of the misconception that we don't make investments in the community for uncompensated care. It's actually what I found to be quite opposite of that. We have about $1.5 billion that we invest into community programs throughout the state. About $800 million of that is in Northern California, and about $87 million of that is for medical services that people can't afford. So we have a finance department that actually grants. We had 53,000 patients last year that we said that's care that you don't have to pay for, and we compensated it for them. Our emergency rooms, much people I think historically feel like if you're not a member you can't come to Kaiser Permanente. That's not true. Anybody that walks into our emergency rooms, we see them just like anybody else. We don't say you're not a member, you have to leave. And then other things we do in investing in grants, actually, for the safety net providers and other providers out there, where we're actually exporting our evidence-based decision tools, because a lot of the smaller providers out there that are supporting in the community, we figured that they could use some of our expertise in allowing them to practice better medicine and through evidence-based protocols. So we actually export a lot of our knowledge out into those safety net providers, as well as give them grants to help support programs. And then we have programs like the child health plans, and we support Medi-Cal, Medicaid, and a lot of the government programs as well through our participation. So I didn't even realize the investments we made, because again, we're not required to report all that, but it's in our community benefit programs that we have as a nonprofit. So.
Are those hard dollars, or are those actually just like price points?
Actual hard dollar investments.
Hard dollar, like at your cost.
At our cost.
At your
yes.
cost.
Yeah, yeah.
Okay.
So
You want to get in on this with me, Tim?
Well, because we report a lot of things. If we report things at price, the numbers would knock you down. I sound like the Federal Reserve Chairman. But
price versus cost.
But if I talk about real dollars, so if I spent money, I wrote a check to someone, that's a lot of times very, very different. I have, I've lived up here five years now, and we do Packard because, again, the kind of work we do. We're an outsourcer for Kaiser. Everybody up here buys. When their kids get really bad, they end up coming at Packard. So we deal with everybody, and we try to be Switzerland, and just we love everyone, we love the kids, and just work around. So there's no axe to grind here. But I do have friends who I've made over the last several physician friends, and some work at Kaiser because Kaiser's a big employer. And they'll tell me, they say, oh, I'll see them on a weekend. They said, oh, I got one of your kids the other night. And I said, what do you mean you got one of my kids? And they said, well, they came in, they were Medicaid, so we just stabilized them, call Packard, and get them out. And so that was a Kaiser ER, child and stuff like that. So I don't know the pricing mechanisms, because we get called, and how